Hi, I'm Dr. Bryan Haugen, professor of medicine and pathology here at CU Anschutz. I'm also the director of philanthropy for the Department of Medicine, and I'm here to give you another installment of Ask a Scientist. The question before us today is the use of ivermectin in cancer therapy. I think many of you have heard about this in the lay press, and I wanted to tell you a little bit about ivermectin and also focus on studies, on how we do clinical studies to sort of look into whether something is effective and safe. Um, Ivermectin is used to treat parasites in animals and people. And interestingly, it was basically the area was first researched in the 1970s when some scientists were looking at soil samples for microbes, bacteria, and other microbes that were effective against parasites. And they found a certain microbe that secreted something that looked like ivermectin, and then later ivermectin was synthesized based on that. Interestingly, that led to the 2015 Nobel Prize in medicine or physiology. In the 1980s, this was then used and approved for use in animals and humans. Um, so the question before us is, it's a good drug against parasites in people and in animals. What about cancer? Well, as I've talked about before, what we need to do when we're considering a drug or a series of drugs as a therapy is we need to go through some various studies to prove that it's safe and effective. The studies include preclinical studies, which a lot of times start with cells in a dish. In our case, for cancer, cancer cells in a dish called in vitro studies, or in animal studies that are preclinical studies called in vivo studies. And interestingly, with ivermectin, there are some studies that show it does look like it's effective against cancer cells in a dish at fairly high doses. And there also are some mechanisms that people have teased out of how it may work. So then they can also look at how best they could pair it with other therapies. The clinical trials then that we look at in people are basically three types: phase one, phase two, and phase three trials. The phase one trials basically are set up to look at safety. They also do look at effectiveness, but the number one reason they're doing it, or the primary endpoint, is safety. Phase two trials are then beginning effectiveness trials where they use dozens of patients to sort of see if there's a signal and also use that study to power a larger study to say, can we see a difference with this new drug versus a standard of therapy, old drug, or versus no active therapy called placebo? And that's a phase three trial. And those are usually in the hundreds, even thousands of patients. And those are the studies that usually are set up to go then before the Food and Drug Administration or FDA and get the drug approved. So where are we with ivermectin for these clinical studies? We heard that there are some preclinical studies that look promising. There really aren't hardly any studies yet in patients on this for cancer. There have been some individual case studies. There have been some studies in other countries that have looked at small numbers of patients, but really nothing where we can get a good signal. The only real study that I saw available is a phase one trial of ivermectin. So this is a safety trial plus what's called a PD-1 inhibitor. This is one of those immune drugs that are used in cancers. This was presented at the American Society for Clinical Oncology in 2025 and looked at patients who had breast cancer. They only had 9 patients in the study. Safety looked pretty good. And then again, as with phase one studies, they also looked at early efficacy of this. They had what are called 8 evaluable patients. One of them had a partial response. Now, a complete response means you can't measure any tumor anymore with things like a CAT scan or an MRI. A partial response is greater than 30% shrinkage of tumors. Stable disease is between 30% shrinkage and 20% growth. And then anything with 20% or more growth is considered progressive disease. So these 8 patients, one patient had a partial response, so that was good. One patient had stable disease. That's a little hard sometimes to interpret, but if it's in a group of people where the tumor's growing, that's worth considering, but 6 of the patients had progressive disease as their best response. I wouldn't call those exactly encouraging results, but again, remember, phase 1 trials are not meant to say, is this effective? And this is looking at this combination in breast cancer. So I did go to a site that, again, if you ever want to look and say, what trials are there going on, is called clinicaltrials.gov. And there were 2 clinical trials. The next clinical trial after this, called a phase 2 trial, that's now ongoing in patients with breast cancer. And then there also was a trial looking at various antibiotics, antiparasitics, other drugs against cancer. And this study is run out of Mexico and is just getting started. So we don't know the results of those studies, but there really are no other studies. So first off, I would say I wouldn't use these drugs in patients with cancer because we don't have enough clinical study evidence yet. The good news is they're generally safe, especially in the doses that are given for parasitic infections. There are some mild to moderate GI side effects in some patients. And then there are some neurologic side effects, such as confusion, dizziness. But the worst ones, and the ones we're more worried about, are seizures and coma. And actually, an example of how we have to be careful with these, they're just on CBS Colorado on October 23rd, was a patient or a person who took a horse dose of ivermectin for chronic pain, and she ended up dying from seizures, and they believed it was secondary to the ivermectin. Horses get much bigger doses than people get, but this is just a cautionary tale of don't try to use some drug off the shelf for something else. Finally, it's interesting that a woman, Casey DeSantis, who's the wife of Governor Ron DeSantis of Florida, recently announced that Florida is going to be putting some resources into studying ivermectin in cancer, which I think is great. We need these studies. It's possibly effective, looks fairly safe, at least in human doses. So I think it's worth further study. So the way I would summarize this data around ivermectin in cancer is I think it's a very good antiparasitic drug, and they're finding it's treating more and more parasites in people and animals around the world. It has fairly good tolerability at those doses, and it's low cost. So that really is excellent. The problem is there are very limited clinical studies, and I think we need more clinical studies before we can recommend this to our patients. Obviously, what we do is for patients with cancers, we recommend approved therapies first because there are a number of great approved therapies for many different cancers. And I wouldn't even start using this sort of off-label at this point in patients because we just don't know how to use it safely, and how to use it effectively in patients with cancer. But I think there is some interest, and there's going to be more studies, so stay tuned. I hope you have a great rest of your day, and thanks for listening.